Hello students, and welcome back to Survey of Human Anatomy and Physiology, Chapter 13, the Cardiovascular System. Today we're going to talk about blood vessels, Part 3. We've already discussed some of the blood vessels, and so this should be review for you. Remember that arteries carry blood away from the heart, and usually it's carrying oxygenated blood. The exception would be from the heart to the lungs and pulmonary circulation, and then that would be oxygen poor blood or deoxygenated blood. But usually arteries are carrying blood away from the heart that is rich in oxygen. Capillaries are very small, and they're sites of exchange of substances between the blood and the body cells. And the tissue fluid that is in between those body cells. Veins carry blood toward the heart. Usually, veins carry deoxygenated blood or oxygen poor blood, with the exception of in pulmonary circulation. Remember, from the heart or from the lungs to the heart, it's carrying the blood back to the heart, so it's veins, but from the lungs to the heart, the blood would be oxygenated. But all the other veins in the body carry blood that are deoxygenated. Arteries and arterioles have very thick, strong walls. It has an endothelial lining. Now, endothelium is made up of what we call simple squamous epithelium. This is simple means one layer of cells. Squamous is the shape of the cell. It's sort of flattened. Epithelial tissue. Epithelial usually line organs. In this case, it lines the inside of the arteries and arterioles. One simple layer of cell. The middle layer is made up of smooth muscle and elastic tissue, so it can stretch and retract. The outer layer is made up of a connective tissue with a little bit of epithelial tissue. Its purpose is to carry blood under relatively high pressure. So arteries carry blood under high pressure. The smallest arteries are arterioles, so arteries branch off into arterioles. As they get smaller, as these arteries get smaller, the walls get a little bit thinner. The largest artery in the body is the aorta that comes right off the top of the heart. Now let's look at veins and venules. They have the same layers as arteries and arterioles, only thinner. They have flap-like valves that keep the blood from flowing backwards. The blood is moved through the veins and venules from contraction of skeletal muscles, including the diaphragm, but skeletal muscles and under very little influence from the smooth muscle that's found in the wall of that vein or venule. It carries blood under relatively low pressure. It serves as a blood reservoir because it holds on to the blood a little bit longer. Venules are the smallest of veins, so it goes from capillaries to venules to veins. The largest veins are the superior and inferior vena cavas. Now let's look at the walls of the arteries and the veins. Now here's an artery, and you can see how the walls are much thicker in an artery than they are in the veins. Here's the lumen, or the opening in the middle of this tube. Now we're going to see this term again when we go to like the digestive system and the tubules in the kidneys and such. The opening within that tube is called a lumen. So you're going to see that term again. Looking at the artery and the vein, let's look at the different layers. Let's start with the innermost layer, this layer that lines the lumen here. It's called endothelium. Now endo, we've seen that prefix before, the innermost endothelium. It's a simple squamous epithelial layer. What does that mean? Simple means only one cell thick. A simple means one layer of cells. Squamous is sort of a flattened cells with the bulge with where the nucleus is, and then epithelium is the type of tissue, and epithelial cells line the inside of organs and your skin, and we saw it in glandular tissue, epithelial tissue. So that innermost layer is called the tunica interna. So the tunica interna for both the artery and the vein is made up of a single layer of epithelium or endothelium. The middle layer is called the tunica media. The middle layer is the bulk of the arterial wall is smooth muscles fibers with a little elastic connective tissue. It encircles the tube. Look how thick it is on the artery wall and much thinner on the veins walls. So the tunica media, made up of smooth muscle and a little bit of elastic connective tissue. Elastic connective tissue to give it stretch and recoil. The outermost layer is the tunica externa. The tunica externa is a relatively thin layer consisting mostly of connective tissue with irregular elastic or stretch and recoil fibers and collagen fibers. Collagen gives it tensile strength so that it can stretch and not rip. Elastic to stretch and recoil, and collagen to give it tensile strength so it can, when it's constricting or dilating, it does not rip, especially in the artery. Now these the smooth muscle is innervated, or it has nerves from the autonomic nervous system. It can allow for vasoconstriction, meaning the constriction of the contraction of the smooth muscle to narrow the lumen, or vasodilation to open it up to allow for more flow. So these vasomotor fibers stimulate the smooth muscle, and it's part of the autonomic nervous system, and the information comes from the medulla oblongata in the control center, the vasomotor control center of the autonomic nervous system. And you will notice that this vein has valves and the artery does not. The walls are much thinner, the lumens much larger, and the vein is going to have valves where the artery does not. These valves prevent the blood from flowing backwards, so blood will flow only toward the heart and not away from the heart in a vein or a venule. The veins have valves, and what happens is the blood moves toward the heart, and if it tries to backflow, yes, it can be held on for a little bit, but it's not going to be allowed to flow backwards because that valve will shut. Okay, and this is under fairly low pressure, so there's not a whole lot of pressure on those valves, but there is enough to shut it if the blood tries to flow in the wrong direction. And because this is under lower pressure than in an artery, This is important because even gravity, as you were standing still for a long period of time, gravity would try to pull that blood toward the earth and not toward the heart. But these valves help to stop that from happening. And so muscle movement will help to push that blood toward the heart. Venous blood flow is not a direct result of heart action. It depends on skeletal muscle contractions to move the blood alone. So this contraction of these muscles help to squeeze that blood through that vein or venules. And it depends on the breathing, so the action of the diaphragm muscle, and also skeletal muscle contraction. Now look at this graph. Maybe you haven't seen a whole lot of graphs before, but here's a percent of distribution of blood through the body from 0 to 100%. Look at where most of the blood is found. It's in systemic veins. The veins at any given time will have a much higher volume of blood in them than any other of the vessels. Okay, so veins have 60 to 70% of the blood volume carried in them. The lungs only 10 to 12%, the heart 8 to 11%. Systemic arteries 10 to 12%. Capillaries 4 to 5%. So most of the blood, the vessels are large and they don't have thick walls, so you can have a lot of volume in these vessels. So veins carry 60 to 70% of your blood. So at any given time, most of the blood in your body is going to be in your veins. Now capillaries. Capillaries are found between the arterioles and the venules. They're the smallest of the blood vessels. They're actually the innermost endothelium of that artery. You would have that in the arterial, and this is just a continuation of that innermost layer. So you have the thick-walled artery and then the little bit thinner-walled arterial, and it's getting thinner and thinner as it's approaching the capillary until the capillary is just one cell layer thick. And this is an advantage because you can have very easily exchange materials between the environment and the blood that's within that capillary. So this is very important. So it's the smallest of the blood vessels. It's an extension of the inner lining of the arterioles. And then this would go into a venule and then veins, and you would still have a continuation of this endothelium. The walls of capillaries are only endothelium. They're semi-permeable. So what does semi-permeable mean? Well, it means that it allows certain things to move in, but not other things. It allows certain things to move out, but not other things. So it's semi-permeable. So things are allowed to move in and out. A little bit selective, but semi-permeable. There are exchanges being made all the time between the environment and of the body and the blood, and it happens through this capillary wall. Now look at this capillary network. Let's go through these again. Now you have a major artery will branch off into many arterioles. The arterioles will branch again and then branch again, and then each time they branch, they're getting the walls of these arterials, the arterial itself is getting smaller and the walls are getting thinner. Thinner and thinner until you reach a capillary, and you can see the nuclei, the nucleus of those single layer of cells is what those spots are along those vessels, because it's only one cell layer thick. One layer, or one cell layer thick. Okay, so you can see the nucleus of that cell along here. And because it's only one cell layer thick, you can have easy exchange of materials between, you'd have interstitial fluid, or the fluid that's in the tissues here, so you can have exchange of between that fluid of materials and into the blood. So this is where, if it's an arterial, you know it's going to be carrying oxygen-rich blood. So here you would be, through these capillaries, you would be giving up the oxygen and nutrients, and then taking on carbon dioxide and getting rid of what other metabolic wastes, so that these things can continue moving and exchange. Lots of exchange is happening in this area of these capillaries, this capillary network. Okay, let me remind you here also that we have a closed circulatory system, and we mentioned that before. That means that you went from arteries to arterioles to capillaries to vanules to veins and back to the heart. So it's a closed system. So the capillary, that's that endothelium, ends up being the endothelium, or the innermost layer, the tunica interna, or endothelium of the venules, and then they're going to converge to become larger venules, and then converge more and then become veins, taking blood back to the heart. Now again, as the arteries branch off, we call that divergence, and it branches off again, or you have divergence, it branches again and again and again. It's smaller, thinner walls, all the way down to the endothelium when it becomes a capillary. Then that endothelium becomes the inner lining, the tunica interna of these venules. And so now you have convergence. They're converging, coming together to form the vanules, and smaller vanules here forming larger vanules. Okay? Until this vanule will meet up with other vanules to form larger vanules, and then veins, and back to the heart. Diffusion. There is an exchange in the capillaries, like I said, all the time. So diffusion. I've talked about diffusion before. It is the movement of molecules from a high concentration to a low concentration. It doesn't take any energy to do this. It's going to work on a concentration gradient. So it's going to occur naturally. Diffusion is the movement of molecules from a high concentration to a low concentration. So when you have arteries, arterioles, and those capillaries coming off the arterioles, you know you're going to have high concentrations of oxygen, low concentration of carbon dioxide. As you get closer to those vanules, you're going to have lower concentrations of oxygen, so you're going to have less oxygen moving out of the capillaries, and in the tissues you're going to have high concentration of carbon dioxide, so the carbon dioxide is going to be moving into the capillaries as that oxygen moves out. Okay, so It's following the definition of diffusion. Now, osmosis is just like diffusion. It has basically the same definition, only it's slightly different. Diffusion is water through a semi-permeable membrane, the movement of water through a semi-permeable membrane. That single layer of cells in that capillary is considered like a permeable membrane. Water follows solutes. And okay, let's talk a little bit about osmosis. It's the same as diffusion, movement of something from an area of higher concentration to an area of lower concentration. But in osmosis, it is the movement of water from an area of high concentration to an area of lower concentration. Okay? And the second thing about osmosis that makes it different from diffusion is you're always going to have it's going to move through a membrane. And what water follows solutes. Now, what does that mean? Okay, so you have a beaker of water. And just imagine this. Let's make an artificial cell. So we take a permeable membrane, means it's going to allow things to move through the membrane. And we fill this membrane. We tie one end and we fill it up with syrup. Syrup has a lot of sugar in it. Okay? That sugar is considered a solute. It's like a solid within that solution. It's something that is in that solution besides water. Okay, so we tie up the other end of our artificial cell and we drop it into the water. Well, that sugar in the water in our artificial cell is taking up space. Now, is that right? It's taking up space. There's no sugar in the water in our beaker. It's only within the membrane of that artificial cell. So since we have sugar in that water in that artificial cell, then would you agree that the water is in less concentration inside that artificial cell than it is in the beaker? Wow, in the beaker you only have water. And then inside the cell you have a little bit of water, but you also have a lot of sugar. The sugar's taking up space, so you have less water molecules than you do outside the cell. So where's the water gonna go if it's allowed to move through that membrane? Well, it is a semi-permeable membrane, so it allows water to move through it. Well, what's the definition of diffusion? Diffusion is the movement of molecules from an area of high concentration to an area of lower concentration. But we're talking about osmosis. So it is the diffusion of water from an area of high concentration, in the beaker, to an area of lower concentration, within our artificial cell, because there's sugar there, therefore less water, because that sugar's taking up too much space, so there's less water in there, and so the water will diffuse into our artificial cell. And it does this because there are solutes. And so anytime you have a higher concentration of solute on one side of the membrane as compared to the other side of the membrane, it's going to draw that water toward it. Now, there's an easier way to remember this, and just think about if that were, instead of sugar, salt. Proteins could be solids in the blood, albumin and other substances. They're solids in the blood. And the water is going to follow the solutes. So we say solutes, I say solutes suck. It draws water toward it. Anywhere you have higher solutes, it's going to pull the water toward it. Okay, so water follows those solids. It follows across a membrane by diffusion. It is the diffusion of osmosis, diffusion of water through a membrane, and it's going to move to wherever the solutes are in higher concentration. Now, filtration is a little bit different. Filtration is materials are forced through the membrane by some force. And when we're talking about blood and blood pressure and all, it is called hydrostatic pressure. Hydro meaning water, and static the movement of under pressure. Hydrostatic pressure is due to the pumping of the heart. So you can have filtration of materials forced through the membrane because of the force behind it applied by the hydrostatic pressure. So it's filtering things out due to the pressure behind it, the hydrostatic pressure. So we have 3 ways that you can have exchange in the capillaries. Diffusion, movement of molecules across the membrane, across that one single layer cell of cells, that endothelium, across that membrane from an area of high concentration to an area of low concentration. Osmosis, the water, the fluid water part of the blood moving through that membrane, that one single layer of cells, because it is moving from an area of higher concentration to an area of lower concentration on the other side of the membrane. Anytime you have solutes, if it's higher on one side than it is on the other, it's going to allow for osmosis to occur to the area where the solutes are greatest. Okay, filtration, hydrostatic pressure. That heart contracts when you have systole, that vessel, the ventricular systole, that ventricle is contracting. It's putting pressure on that blood as it pumps through those vessels, and that pressure is, because the blood is mostly water, we call that hydrostatic pressure. Now what happens here, we have blood from the arterial, and then we're moving toward the capillaries. Water and other substances leave the capillaries because the net outward pressure at the capillary arterial ends is greater. Water enters the capillary venule ends because the net inward pressure is less. We're going to look at this a little more carefully in just a minute. Substances moving out along the lengths of the capillaries according to their respective concentration gradients. Diffusion or osmosis. Okay, let's look at this. So we know that from an arterial there is going to be higher blood pressure because it's coming from the heart, and we said in the arteries and arterioles the walls are thicker because the blood is flowing under force, under pressure, because of the beating of the heart, that strong muscle pushing that fluid through the vessel is going to be under pressure, so that's why it has the thicker walls. So here's the it's going to have a higher hydrostatic pressure on the arterial end. So because it has a higher pressure, water is going to be pushed out of the membrane due to this higher pressure. But yet there is a little bit of exchange going on because there will be some osmosis as the water leaves due to the conditions in the inside of the blood. Out here in the fluids, you can have some return of water, just a little bit, because there's going to be solids in the blood, more solids in the blood than there is out in this interstitial fluid. So you're going to have a little osmosis going on. But because the pressure is so great here, you're going to have less osmotic pressure, and so you're going to have less movement due to osmotic pressure and more movement of water due to hydrostatic pressure. So you're going to have, look at the comparison of the pressures here. You have 41.3 millimeters of mercury pressure. We can measure the hydrostatic pressure, and so hydrostatic pressure is greater than osmotic pressure here. So you have an osmosis going on, but hydrostatic pressure is a much stronger force. So the net force on the arterial end, the outward force, including hydrostatic pressure, is the 41.3. These numbers are not that important. I just want you to remember that this blood is flowing under pressure, so the filtration outward by this hydrostatic pressure is going to be greater than osmosis sending water back in. Now there's solids here, or solutes, and I told you that the water will flow to where the solutes are greatest, because oh gee, there's more water out here than there is out here in this vessel because there's solids in here. There's proteins, albumin, and other things that would take up space where you could have water. Because they're in there, the water concentration is lower here than it is out here. Osmotic pressure, though, is less. On this end, you're going to have a higher net outward push. Okay, the outward push. So more water is going to be pushed out. The osmotic pressure isn't enough to bring that much water back in. So you have the movement of a little water in, but you're losing more water because of the hydrostatic pressure and filtration. Okay, so remember, as the blood moves through these vessels, we've talked about this before, the blood pressure decreases. Alright, so in venules and veins, the pressure is low. In the arteries, the pressure is high. That's why in a vein you don't need thick walls, because the pressure in this blood is low. Look at these numbers. Okay, in the capillary, you're going to have some exchange going on. But in the venule end, the outward force, look at this pressure compared to the arterial end. You only have 21.3. And remember that the osmotic pressure was 28. So you're not having as much water pushed out from the pressure, from the hydrostatic pressure, but you're having water replaced in this vessel by osmosis, because its inward force of osmotic pressure is greater. So on the arterial end, you're going to be pushing out water. On the venule end, you're going to bring it back in. Okay, osmotic pressure. It is the influence. Okay, so you've lost water here. The more water you lose, the more solids you're going to have here. The more proteins, albumins, and other substances found in this blood. So you've lost some water, so low concentration of water. So the water is going to move back in on the venule end. Okay, so on the arterial end you have a net force outward. On the venule end, that's on the arterial end. On the venule end, you will have a net force, osmotic force, pushing that water inward. Okay, so we pushed it out here, and now it's been pushed back in. Okay, it's going to move in respect to the concentration gradient. So here we lost water, so the concentration gradient, you have a higher solute here, so the water is going to move to where you have more solids, because there's going to be, if there's more solids, there's going to be less water. So you have osmotic pressure. Sometimes you may hear this, I just want to throw this in real quick. You may hear this being called colloidal pressure. A colloid is solid suspended in a liquid. If you go to your refrigerator and your milk is set there too long, maybe it's not quite out of date, but nobody's bothered it for a few days, and it's set there a while, and you can see a clear liquid on the top and solids settle down toward the bottom. That milk is a colloid. It has solids suspended in a liquid. Okay, so that's a chemistry term. A colloid, a solid suspended in a liquid. That is what milk is. Well, in our blood we have solids suspended in this liquid, and the liquid is the plasma, and plasma is mostly water. So if we're losing water, we're going to hold on to more solids. So on this end we call that it is osmotic pressure, the force from the osmotic pressure, but we also call it colloidal pressure. Vessel disorders. Arterial sclerosis. This is a condition where you have accumulation of fatty deposits, and it's usually cholesterol. It's lining the artery walls, arterial walls, or endothelium. It sometimes is initiating inappropriate clotting, so it can cause blood clotting and hardening of the artery. Plaque in that artery, and that plaque can break off and cause major problems, and it also restricts the blood flow. An aneurysm can be compared to bicycle tires have an inner tube inside of them. And you take this, when you want to work on this tire, you take the inner tube out. And if you've ever looked at this rubber inner tube, and you pumped it full of air, if it has a weak spot or a thinner area of rubber, you're going to have a little bulge. You might have had this on your car tire, where you have a blim, a bulge on the wall of the tire, or on on some area of your tire. It is where the wall is thinner. An aneurysm is where the wall of the arterial wall is weakened, thinner, and you can have a bulge in that area, and that is called an aneurysm. Now, you might have heard of somebody who's had a brain bleed from an aneurysm. Well, that aneurysm, it's like, okay, so that heart is pumping, that ventricular systole, it's squeezing that blood, and that blood's going through that vessel under a pressure. Well, it's like putting more air in that tire and more air in that tire, and we start seeing a bulge where that thinner rubber is on that tire. And the same thing would happen to this vessel. A thin area of this vessel, and that vessel can burst. Okay, so an aneurysm would be a weakened area of the artery wall, arterial wall, where higher pressure can cause a bulge and even rupture, where you can have loss of blood, and if it's in the brain, it can be very serious. If it's in a major vessel, blood loss could mean a bleed out before you can do anything about it. Varicose veins is abnormal, irregular dilation of the superficial veins. It's increased back pressure. Remember, those veins have those valves, and you have to move the blood through those veins, through skeletal muscle contractions, and from crossing the legs or sitting a long period of time, the blood may pool and increase the back pressure, and it causes these abnormally irregular dilations of the superficial veins, and that's where varicose veins come from. Phlebitis is a condition where you have discoloration and dilation of the surface veins. It usually goes along with deep muscle pain, redness, and swelling. And it's that one condition that can cause phlebitis, let's pronounce it correctly, is a deep vein thrombosis, a blood clot in the vein. And it's basically cutting off the blood supply to the area and causing the dilation of the surface veins and deep muscle pain, redness, swelling, discoloration. Okay. Arterial blood pressure. Blood pressure is the force of the blood against the inner walls of the blood vessels. So it's the force the blood exerts against the inner walls of the blood vessels. Arterial blood vessels or blood pressure rises when the ventricles contract. When you have ventricular systole, the blood pressure, arterial blood pressure, will rise. It falls when the ventricles relax. Remember, systole was contraction, diastole, relaxation. You've heard of these terms perhaps when somebody's getting their blood pressure taken. There is a systolic number and a diastolic number. Those numbers refer to blood pressure. Systolic pressure is measured at maximum pressure when the ventricles are in systole, are contracting. Diastole, remember, means relaxation of the ventricle, so diastolic pressure is the minimum pressure, so that's when the ventricle is relaxed. So taking a blood pressure, you're getting two numbers. You're getting a measurement of the systolic pressure, and you're getting a measurement of the diastolic pressure. So that blood pressure cup is, you're getting a reading, and as you put on the blood pressure cup over that brachial artery and pump up that cuff. By the way, that's called a sphygmomanometer, and you should be, along with this lecture, you should be doing your lab that will demonstrate how to use a sphygmomanometer. I have other videos available to you on how to take a blood pressure. But putting that blood pressure cuff on over the brachial artery and pumping it up, and there is a gauge that is watched, and the gauge is going to help to measure the systolic pressure and the diastolic pressure. So the first number is when, after you're listening with the stethoscope, and the first number is going to be when you hear, it sounds very much like a heartbeat, and it's going to be that heartbeat under pressure after that ventricle has contracted. So you hear the heartbeat, you take the first number. Then you listen closely, and that heartbeat, the pressure is dropping, so that sound is going to be less audible. It's going to be lighter and lighter, and then less and less, and then it goes away completely. At the moment that it goes away completely, that's called the diastolic pressure if you were reading a blood pressure, and that is when the ventricle is in relaxation. It's relaxed, so you're in ventricular systole, the minimum pressure, diastolic pressure. Taking a pulse, a pulse is the alternate expanding and recoiling of the arterial wall that can be felt. The most common place to take pulse is from the radial artery. It's fairly easy to take it at the carotid artery. You're going to use your index and second finger, index and middle finger to take a pulse. You never use your thumb. You can read a pulse, get a pulse on the carotid artery on the side of the neck, the temporal artery on the side of the head, the facial artery, brachial is at the bend of the elbow, femoral artery on the inside of the leg, the popliteal on the back of the knee, the posterior tibial artery is on the inside of the ankle here, close to the bone, and then the dorsalis pedis artery is on the top of the foot. So when there's been an injury to the leg, sometimes to make sure there is systemic circulation and circulation of blood through the legs, they will check the pulse at these two places to make sure that this leg is getting a good blood supply. Factors that influence arterial blood pressure. As blood volume increases, blood pressure increases. As heart rate increases, okay, that ventricular contraction, if you're having more of them, it makes sense that the blood pressure is going to rise. Stroke volume also increases. Stroke volume is the amount of blood being pushed when that ventricle contracts. So as stroke volume increases, blood pressure is going to increase. Blood thickness or viscosity increases, the blood pressure is going to increase. The peripheral resistance, as those smooth muscles, if the smooth muscles in that artery and arterial constrict, it's going to cause resistance. So as peripheral means away from the main line, peripheral resistance increases, it's also going to increase blood pressure. Now, if you think about a bleed, if a person is hemorrhaging, they have blood loss. So what's going to happen? Well, you're going to have a decrease in the blood volume. Therefore, you're going to have a decrease in blood pressure. Well, that's away from homeostasis. That's away from the norm. So in the medulla oblongata that controls the Heart rate doesn't control the contraction of that heart tissue, but it does control the rate of those contractions. So it sends information to that the sinoarterial atrial sinoatrial node to tell that heart to increase in number of beats. So the heart rate increases, trying to raise that blood pressure. And if the blood volume decreases, it's going to affect stroke volume because there is going to be less volume to push. Okay? So what's going to happen to the peripheral resistance? Those smooth muscles, because of the autonomic nervous system, is going to have a sympathetic response. Sympathetic response will cause those blood vessels to constrict more for more peripheral resistance to try to help to raise that blood pressure. Okay, as fluids are being lost, viscosity, the blood's going to get thicker. Okay, but it all starts with the loss of blood volume. So it's the way, these are things that can happen to try to bring the blood pressure back up. So you're taking care of a patient and their heart rate has increased, their blood pressure has dropped. One of the first things they do is hang a bag of saline to try to replace fluids so that stroke volume can increase. The blood volume can increase with fluids. So they're replacing fluids. If the blood pressure does not come up significantly, then there is a problem. Cardiac output is the amount of blood that leaves the heart per minute. When cardiac output increases, blood pressure increases, blood volume. Okay, cardiac output is affected by heart rate and the amount of blood that leaves the heart during each beat, or the stroke volume. Blood pressure is proportional to blood volume. Blood pressure falls during a hemorrhage, as we mentioned a few seconds ago. Resistance to the flow. The peripheral resistance is the friction between the blood and the walls of the blood vessels. So as the size of the arteries change from the constriction or dilation of those blood vessels, it's going to affect the resistance to the flow. Peripheral resistance, the friction between the blood and the walls of the blood vessels, must be overcome for the blood to flow. It is affected by the size of the arteries. At the inside of the lumen in the arteries, the size will affect blood pressure. As arteries dilate, blood pressure decreases. As arteries contract, the blood pressure increases. So let me just say, I mentioned just a minute ago the medulla oblongata. It regulates heart rate, but it also regulates the constriction of those smooth muscles in the arteries, or the dilation of those smooth muscles in the arteries. So it can influence blood pressure by doing either constricting to raise the blood pressure, like in that hemorrhaging, or if the blood pressure is too high, then there's actually baroreceptors. They sense blood pressure, hydrostatic pressure, and that information, it's in the aorta and the carotid arteries. You have these areas where these sensory receptors are higher, and if it is indicated that the blood pressure is too high, that information is sent to the medulla oblongata, and it can regulate the constriction. Or if the blood pressure is too high, it will cause the arteries to dilate to try to decrease the blood pressure. If there's hemorrhaging and the blood pressure drops, then the medulla oblongata will affect that. This would be sympathetic. You'd have contraction of those arterial walls, so blood pressure will increase. The dilation of the arterial wall would be from the parasympathetic. Sympathetic contraction, parasympathetic dilation. Viscosity is the physical property of the fluid related to the ease with which the molecules flow past one another. And viscosity, as viscosity increases, blood pressure increases. As the loss of fluids, viscosity increases. Viscosity is basically the thickness of the blood. The thicker the blood is, when it becomes thicker, it's going to raise blood pressure. A thinner blood, lower blood pressure. Less fluid, lower blood pressure. Control of blood pressure, we just mentioned some of these things. Affecting the size of the blood vessels, the vasomotor center in the medulla oblongata. And the autonomic nervous system affects the SA node, the sinoatrial node, that will affect heart rate. And the medulla oblongata, controlling those smooth muscles within the vessel, and the vasomotor center. Hypertension is a disorder, high blood pressure. High blood pressure. Hypotension would be low blood pressure. Hypertension. Normal blood pressure would be, remember, this number is the systolic and this number is the diastolic. So normal would be around 120 over for the systolic and 80 for the diastolic. Mercury's millimeters of mercury. And a man under 45, hypertension would be around, this is actually a little borderline here. 130 over 90 would be borderline. It would be considered high if it is 140 over 95. And that's not necessarily that would be anybody, not just a man under the age of 45, a man over the age of 45. Hypertension. A man under the age of 45 should have a more normal blood pressure. So if he's under the age of 45 and he has this borderline blood pressure, his doctor may become concerned. Anything over 130 over 90 is considered high blood pressure. Right, a man over 45, 140 over 95 would be a high blood pressure. Blood pressure is going to run a little higher the older you get. Let's look at now hypotension. Low blood pressure, of course, would be lower numbers. Now, we're talking about low blood pressure would be like closer to the 90s here and closer to the 50s here. Okay? Now, an athlete may have a lower blood pressure, and if the clinician doesn't know that this person is an athlete and they come in say, to the emergency room unconscious, and they take their blood pressure, and they have a lower than in the 90s over the 50s, it could draw concern, because that would be a low blood pressure for the normal person, but an athlete could have a lower blood pressure because they're moving that blood in a more efficient way because of their condition. Alright, so anyway, in the 90s over 50s would be low blood pressure. Paths of circulation, we've talked about this a couple of times before. Pulmonary circulation would be heart, lungs. Systemic circulation, everything else, including the heart. Okay, pulmonary circuit consists of vessels that carry blood from the heart to the lungs and back to the heart. We've talked about this. Okay, so from the right ventricle, the blood is pumped through the pulmonary to the pulmonary through the pulmonary valve, the semilunar valve, to the pulmonary trunk, to the pulmonary. It's going away from the heart, so pulmonary arteries, low oxygenated blood here, deoxygenated blood, to the lungs, where they branch off, diverge, or branch off into arterioles, and arterioles into capillaries. Then you have that exchange of carbon dioxide and oxygen, and then we'll talk more about that when we talk about the respiratory system. And then that oxygen-rich blood, those capillaries to venules, to veins, and remember these in pulmonary circulation, or the pulmonary circuit, the veins are going to be carrying oxygen-rich blood, which is not like systemic. Okay, the veins going back to the heart, to the left atrium, to the left ventricle, through the aortic valve to the aortic, the ascending aortic and the descending aortic, the aortic arch. Okay. But between the heart and the lungs is called the pulmonary circuit. The systemic circuit, composed of vessels that lead from the heart to all parts of the body except for the lungs and back to the heart. It includes the aorta and its branches. It includes a system of veins that return the blood to the right atrium, and composed of the vessels that lead from the heart to all the body parts except for the lungs. That includes that heart tissue also. Systemic circulation, the systemic circuit. And that concludes part 3, and that concludes chapter 13. Do not neglect going through your labs and going through the blood vessels that you are responsible for, and locating them on the vessel board and in your lab manual, and complete that before you finish up chapter 13.